Hi guys, welcome to my channel. This is Ed Discourse Ask Your Doctor. In today's video, we'll be discussing what I term hypotension. What do you understand by hypotension? What are the causes of hypotension? What are the symptoms of hypotension, as well as what are the treatment measures that will be required as a form of first aid or as a form of care for hypotension? So what do you understand by hypotension? Hypotension simply means low blood pressure circulation across the blood vessel, in which the oxygenation of the tissues, cells are below the required. This is because the pressure at which the blood is meant to be circulated across the blood vessel to all the tissues and the cells has reduced below the expected range of blood pressure. So when this happens, oxygenation of those cells are impaired, and when there is impairment of oxygenation of those cells, the functions of those cells are also affected. That is the reason why the symptoms we are going to be discussing it today are going to be manifesting in those individuals that have hypotension. What are the causes of hypotension? Causes of hypotension include the following: dehydration. Dehydration either coming from excess vomiting or coming from excess diarrhea, which is stooling. Either of these, when they are in excess, the individual will dehydrate, and when there is dehydration, it leads to decrease in the volume of the blood in circulation. The component that is affected in this particular condition is actually more of the plasma volume. But you agree with me, what makes up the blood includes the plasma component, as well as the cell component, the white blood cell, the red blood cell. So when there is dehydration in form of excess vomiting or excess diarrhea or stooling, it can lead to severe dehydration, which can lead to hypotension. The other cause includes blood loss. Blood loss can be in several forms, either from heavy menstrual bleeding or injury coming from accident, domestic accident, road traffic accident, or any form of injury that can lead to a breach in the skin integrity, thereby leading to loss of blood through the skin or any other part of the body. There could be blood loss through surgery. Any of the causes of blood loss from the body can definitely lead to what we call hypotension. The other causes of hypotension include severe infection, which we call sepsis, anaphylactic reaction, which is allergic reaction, pregnancy-induced hypotension. In certain individuals during pregnancy, it has been noted that their blood pressure reduces, and it could be so severe enough to cause hypotension in those individuals. The other cause is what we call cardiac origin. Those with heart problem can as well come with what we call hypotension, because if they have heart problem that involves the inability of the heart to be able to pump at the normal rate it is expected to pump blood, it can lead to hypotension because of the reduction in its ability to pump blood into the body parts that are expected. So what are those signs and those symptoms you are going to notice in an individual with hypotension? In an individual with hypotension, you are going to notice sudden sweat. The individual begin to sweat on the face or even other body parts. There could be coldness of the extremities, coldness of the hand, or coldness of the feet. Even when the weather is not cold, you could notice dizziness, fainting attack, generalized body weakness. You could notice the individual is confused. So this will be noticed in an individual, and it happens in a short while and as fast as possible, so that the individual was okay before all of a sudden all this starts. So these are the symptoms the individual is going to manifest when the individual is having hypotension. There could even be fast breathing in an individual or increase in the heart rate of an individual. These are the signs and symptoms that the individual is going to manifest. So what are the treatment modalities or the first aid measures? When an individual is experiencing that fainting attack and you notice that the individual is having hypotension, the first thing you want to do is to allow the person to lie on a flat surface so that the blood can be uniformly circulated to the brain and every other body part when you allow the individual to lay flat on a flat surface. The other thing you want to do is to note the primary cause of such. When the primary cause of such is noted, addressing the primary cause is the major and the gold standard in this treatment. You address the primary cause. If it is an infection, the individual is treated urgently. The primary cause is also arrested if it were obvious bleeding. If it is dehydration, you replace the fluid immediately as an emergency. If it is blood loss, you replace the blood loss as an emergency. By and large, A case of hypotension is an emergency case that is not meant to be treated at home. It's meant to be treated at an healthcare facility. So when you notice through what you have gained through this video that an individual is tilting into hypotension, what you want to do is to take the individual immediately to a nearby health facility where all these measures will be instituted. The measures include treating the underlying cause, arresting the underlying cause, fluid replacement, blood replacement, as the case may be. Whichever one is suitable for that individual will be instituted as fast as possible. I'm sure you have gained value through this video. Don't forget to subscribe to this channel. Don't forget to go through the videos I've uploaded in the previous times and also watch them for personal knowledge as well as health education. Till I see you next time, thanks for watching. Bye for now.